Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Pane, for this week's Ask Dr. Pane segment, this lady from Miami, Florida, has a question. What's the best choice for non-invasive procedure to get rid of stubborn stomach fat? They do work out a few times a week, and they just have a little problem area they want to get rid of. Dr. Pane, what would you suggest here?
Well, it's an excellent question because I know they said non-invasive, and when you look at the pictures, there is a little bit of fat in the lower part of the belly, not enough for a tummy tuck or anything like that. But when you talk about non-invasive procedures, you mean no injection of anything, essentially topical. And companies have been trying to give us something that can work instead of the traditional liposuction type procedures for a long time. Now, what you have to keep in mind is we've had some of these technologies going on for about 4 or 5 years, yet we're still doing a fair amount of liposuction, a lot actually. And that is because these technologies, as interesting as they are, they seem to have more limited ability to actually replace the process that what is going on with liposuction. And we've talked about this before, that a lot of times with the fancier styles of liposuction, really what's going on is the removal of fat and compression and good post-operative care. So in terms of non-invasive, there's really no terrible choice. The worst thing that can happen in most cases would be that you're out the cost of the treatments if it doesn't work to your expectations and you've put in some time and effort. Very few of these things can have real damaging results. One I would caution you against is fat dissolving injections. It sounds non-invasive, but you can get some serious problems if you do that, except for a very limited application that is right now being marketed for under the chin. So I would say, instead of thinking about non-invasive, think about minimally invasive and then weigh off the different options as to what you want to risk in terms of your time and resources in investing into a treatment that may or may not have some effectiveness. In that small area that she was looking at, this could be done with a local anesthesia liposuction procedure, which is not non-invasive, but you could call it minimally invasive, and more importantly, very reliable. You can compare that to some of the other technologies, which I won't name any brand names, but a lot of them have to be done several times. And when you add up the cost of each of those treatments and your time spent, it may not actually be, I mean, it's non-invasive from a physical standpoint, but it may be more invasive in terms of your time and your resource that cost you. So I would consider those options. They're easily sought online. We don't offer them yet. We do some radio frequency, but we don't use it to replace liposuction. We use it more for skin tightening, and that is different. And we could go over that in more detail any other time. But I would say weigh some of those non-invasive things against what would be considered the gold standard here, which would be not non-invasive, but minimally invasive, basic liposuction procedure. And again, the different technologies are all about the same. And that would have a reliable way of addressing her concern. And it's not, minimally invasive. So that would be my best recommendation, because I think it will be most likely to provide her an outcome that she is looking for, from what I heard and saw with the pictures there.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our website, Facebook page, LinkedIn, or Instagram account. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.